All right, next classification of drugs. So for the next classification of drugs, we are looking at what? Sympatholytics. We earlier on looked at sympathomimetics, where we said that there are drugs that mimic the actions of the sympathetic nervous system. So everything that the sympathetic nervous system is doing, those drugs will enhance it. So sympatholytics, of course, it should be opposite of sympathomimetic, okay? They should tend to actually depress the sympathetic nervous system. So sympatholytic drugs, we said that they are also known as adrenergic antagonists or anti-adrenergic drugs. So they are medications that block or reduce the effect of the sympathetic nervous system. They are just opposites. So the most important thing is looking at their classifications. So we have the ones that will basically block the α-Adrenergic receptors. So we have the non-selective ones. So those ones will block the α-Adrenergic receptor 1, block the α-Adrenergic receptor 2. So drugs like the Phenoxybenzamine and Phentolamine, okay? So just like that, they can be used for hypertensive crisis, basically to relax the body, okay? So we have the ones that are selective, that they can block only the α-1 receptors. So drugs like the Prazosin, we have the Terazosin, then we have the Doxazosin. All right, so they can be used in hypertension, they can be used in benign prostatic hyperplasia, they can be used in all those post-traumatic syndrome distress or the PTSDs. Then we have the ones that are selective for let me see. Okay, they said that the α-2 agonists can also act as sympatholytics. So drugs like clonidine, metaldopa, guanfacine, right? Then the dexmedetomidine rather. So they are also using all those hypertension, opioid withdrawals, attention deficit hyperactivity disorder. All right. So we also have the adrenergic blockers that basically these ones, they block the beta receptors. So drugs like the Propranolol, the nadolol, and the timolol. So those ones are basically for the beta blockers, right? And for the three that I listed, those ones, they block both the beta receptors, the type 1 and also the type 2. All right, so they are using thyroid storm, they are using tremors, they are using glaucoma, they are using angina, then arrhythmias. Okay. Then the ones that are selective for beta 2. So drugs like the metoprolol, the atenolol, the esmolol, the bisoprolol, and the nebivolol. Okay, using hypertension, using myocardial infarction, using heart failure, using tachyarrhythmias. Then we have the mixed, the ones that will block alpha and beta. So we have drugs like the labetalol and the carvedilol. All right. So this is what we got for all these drugs, right? So these ones, they are majorly used to what? Relax the body. So if there's hypertension, they relax. If there's benign prostatic hyperplasia, they relax. If there's heart failure, they relax. If there are arrhythmias, they relax. If there's glaucomas, they relax. Pheochromocytoma, thyroid storm, tremors, migraines, they basically relax the body for that.